Hello everyone, this is a lecture covering the case study 13.1 that is on page 127 in your workbook. As we look at this part, I'm sorry, it's not on page 127, it's on page 123. As we look at this case study, we see that this patient comes in with a complaint of seizure, and that seizure will be the principal diagnosis code. And when we code seizure, this is just a seizure. This is not epilepsy, it's not recurrent seizure. The code for seizure is Fa16.9, so that's our admission diagnosis. The next question that you were asked to answer, beginning with the questions on page 125, was the discharge disposition. This patient went home. That's clearly documented in this medical record. In the discharge summary, it tells us that the patient was going home. Tells us in the progress note that the patient was going home. So this patient went home. Then the next thing we have to determine is, what is the principal diagnosis code? Well, in looking at the H&P and looking at the discharge summary, this patient came in with alcohol withdrawal seizures. He actually EMS witnessed a seizure, and in the discharge summary it tells us that in the ER he actually had 2 additional seizures. And so we are going to code this withdrawal. We go to dependence, alcohol with withdrawal, and this withdrawal is uncomplicated. We don't choose the F10.239 because that's unspecified. We don't have delirium, we don't have perceptual disturbances. We choose uncomplicated. He went home in 2 days. That's F10.230. We can verify that code in the tabular and scroll up. Now, our instructional notes tell us if we know the blood alcohol level to add a code for that. We don't know the blood alcohol level. There is not another code we will use for this alcohol withdrawal. We don't then come in and code F10.20 because we have one code for alcohol dependence with withdrawal. That's a combination code. We don't have any other codes for that. For 13D, you were asked to indicate the additional diagnoses and the present on admission indicator for those additional diagnoses. Well, we know this patient had seizures, R65.9. We've already coded that. And yes, that was present on admission. In addition to that, we can see that he is positive for tobacco. That's in the H&P in the social history. Now, it doesn't tell us in here that he has tobacco dependence. It just says use. So the most appropriate code is Z72.0. If you actually coded this to tobacco dependence, come on. We have to do dependence nicotine. And then it says to do dependence, drug, nicotine, and then we will choose cigarettes, F17.210. If you assigned that code, I am not going to deduct any points for that. Now it says occasional cocaine. So if we do dependence, drug, and then cocaine, F14.20, verify that in the tabular. All we know that is that he has the cocaine. I'm sorry, we're not doing F17.20, F14.20. We are doing abuse, not dependence. Abuse, cocaine, abuse, drug, cocaine, F1410. So our code is F14.10 in this instance. This patient also lacerated his forehead. So we're going to do laceration, forehead, S01.81. When I verify that in the tabular, I do have to have, it's a red code, I have to have additional characters. If I scroll up to the beginning of my category, it tells me I have to have a 7th character of A, so I know that my code is going to be S01.81XA. Let me get back down here to my code. And if I click on that code, then I can see S01.81XA. Now, this patient fell, and so we can go into our external cause tab, and we can actually code the fact that this patient fell. And the general rule code for a fall, it says unspecified fall. That code is W19, and we have to add the 7th character, so it'll be .xxxa. And then also he fell on the same level he fell at home. That would be the same level. It doesn't tell us that he fell down the steps or anything like that. W18.30, and then that is going to be XA. Now the other thing that we need to code is the repair of the laceration. So we're going to go to procedures, and we know we're in medical surgical, and it's the skin. We're coding the repair of the skin of the forehead. That's what he cut. And it's a repair because the repair is restoring a body part to its normal anatomical site. And this is going to be the skin of the face. It's external, and there's no device, and there's no qualifier. So 0HQ1XZZ is the procedure code. Now, in going through and looking at this assignment, several of you coded X-rays. If I had you in the classroom, I would threaten to bring my ruler and smack you on the hand. X-rays do not meet the definition of a significant procedure. We do not code X-rays in the inpatient setting or the outpatient setting. Those codes come from the charge master. So do not code X-rays. This case groups to DRG 897. And when we go to the grouper, we're going to choose, this is a male, he's 45 years old. I gave him a 3-day length of stay. So once I change the gender and the age and the admit date, I'll hit continue. This patient went home. It's well documented that he went home. He was referred to AA. Our admit diagnosis, and there is one and only one admit diagnosis. That's R56.9. And our principal diagnosis, we said, was F10.230. And then we're also coding the fact that the patient had seizures. And then we're going to add the code for the cocaine abuse, the laceration, the tobacco use. Then we can add our codes for our external cause codes. And then we can add our procedure code. And when we've done this, we can add our present on admission. And for present on admission, all of these conditions were present on admission. Now, we didn't code the hypertension. If you coded the hypertension, I'm not going to take off points because in the progress note on day 1, it says BP has been normal without medications. However, the BP is a chronic condition. The patient did come in with that diagnosis. They did monitor him for it, so I think it is appropriate to code that. Once we get these diagnoses in, then we're going to hit compute. And when we hit compute, we can see that our DRG is 897. And so this is the DRG that you need. Now, 13H asks you if there is a guideline that governs the selection here. And this patient came in with seizures, but that's a sign and symptom. And so we know that it cannot be the first listed diagnosis code. And then also with 13K, the history and physical does say that the patient had dry mucous membranes. So you could possibly query this physician to determine whether or not this patient had dehydration. And the patient, the medication that you're asked about, thiamine, that is used for a thiamine deficiency. So that will conclude this lecture for case study 13.1. Please let me know if you have any questions.